White House is now strongly recommending to governors that all nursing home residents and staff get tested for COVID-19 in the next 2 weeks. As CBS 4's Kelly Rinke explains, the association who represents those facilities in Indiana believes that task is unlikely in our state.
Our most vulnerable population inside long-term care facilities is a target for COVID-19. More than 40% of virus deaths statewide are connected to these centers.
We are heartened that the federal government is now turning its attention to long-term care facilities.
Zach Cattell is the president of Indiana Healthcare Association, which represents nursing facilities and assisted living communities. This week, the White House recommended to governors that all residents and staff at nursing homes be tested for coronavirus in the next 2 weeks.
Whether or not that can be done in 2 weeks, I don't think that that's a reality in Indiana. We wish it were. We wish it was a reality right now.
Health Commissioner Dr. Christina Box explained that would mean testing roughly 100,000 people in 2 weeks, which could be a challenge since it took the state roughly 2.5 months to get to this number today.
We have used the limited testing that we have had across the state very judiciously in especially our long-term care facilities, and been very careful to test even asymptomatic individuals there.
The State Department of Health says they have visited every long-term care facility to provide education and training about COVID-19. Several centers have turned to private labs to test more residents and employees.
And piecemealing these things together over time to create more and more private lab testing is what is going to be the key in order to sustain the right amount of testing in order to contain the virus as best possible.
Broad-based testing is something that we've been talking about for a while now, so it's good to see an effort being made to deal with that.
SEIU Illinois Indiana applauds the recommendation. This chapter of the union represents about 500 nursing home workers in our state.
Pretty heavy lift to do in 2 weeks, but I do think we do have to set an expectation that folks working in nursing homes would get tested.
Advocates hope Indiana can reach this mark soon, so facilities have more information to help contain the virus and save lives.
I'm hoping that between our state and federal governments and the private lab resources, we can continue to increase that capacity.
In Indianapolis, I'm Kelly Rinke, CBS 4 News.